friends, and welcome to this short video on relaxing Chinese exercises for lung health. My name is Chris and I'm hoping you can join me in doing some of these exercises together. If you find for any reason standing is too difficult for you, if you have maybe problems with the lower joints, then you can do these exercises in the seated posture if you wish. Okay, let's get started. Okay, so the first thing we're going to do is just show you a exercise on how we breathe normally and naturally to give you a sense of how the chest and the lungs normally work. And then I'm going to show you an exercise that actually helps to improve how you breathe. So first of all, just bring the hands up, bring the palms together and just softly rest them on the top of the chest. Relax the shoulders. Stand normally, stand naturally. And breathe normally, breathe naturally. And what I'd like you to do is just be aware of how you're breathing, what's happening in the chest physically as you breathe in and as you breathe out naturally. What you should feel is the chest softly rising as you breathe in and the chest softly lowering as you breathe out. And when you do this, you start to realize that when we breathe normally, we tend to breathe from the chest. Okay, so what I'm going to do now is show you an ancient Chinese, what's called standing post posture, that helps to start to improve how you breathe. So we're going to stand, feet shoulder width apart, toes pointing forward. We're going to work our way up the body. We're going to bend the knees first of all, and again you don't have to bend the knees too deeply, but when you bend the knees you engage the muscles in the legs, and it also helps to relax the upper part of the body. The radical thing we do with this posture, and this is called standing post posture, okay, is what we do is we just softly and gently tuck the pelvis forward like this. It's like sitting down on a high chair, and you want to be as relaxed as you can be, and that helps to straighten the back here at the lower part of the spine and also relax the stomach muscles. What we then want to do is bring the head up, and again the Chinese say you imagine you're balancing a cup of tea on top of your head. We're going to relax the shoulders. This is very important. Now the arms hang down by the side. Okay, and what we're going to do is just focus on our breathing. We're going to pay attention to how we are breathing. We're going to softly breathe in and we're going to softly breathe out. And what we're going to try and do with this method is to try and release tension in the body. We're going to try and relax with this posture. And what we do is softly breathe in, softly breathe out, breathing normally, breathing naturally, but we try and release and relax, or song as the Chinese call it. So when you feel yourself get nice and relaxed in this posture, what we're going to do now, bring the left hand up and rest it on top of the chest, relax the shoulders. Bring the right hand down and about 3 finger widths below the belly button, going to rest it on the palm. Now again, what I want you to do is breathe normally, breathe naturally. As you breathe, again, be aware of what's happening in the body, in the chest. How is the chest moving? Is it moving differently? Also now be aware of the abdomen. Does the abdomen feel as though it's moving when you breathe? So this posture actually changes very slightly the way we breathe. What you might start to feel, and it takes a bit of practice to do this, is you might start to feel the chest softly rising as you breathe in. But as you breathe out, instead of the chest lowering, it's the abdomen relaxes, and actually the abdomen expands outwardly as you breathe out. Okay. What this is when you stand in this posture and you breathe like this, what you're doing is you're engaging the diaphragm more. Okay, so if you're not familiar with this term, the diaphragm is a thin sheet of body tissue that lies just below the lungs, and it's part of our breathing system. And when it's normal, its position is normal, it's like a dome shape underneath the lungs. And when you breathe in, it creates tension in the diaphragm, and it pushes the diaphragm down slightly and creates more space in the chest area and in the lungs, and helps more oxygen to come in. And when you breathe out, okay, it comes back to its normal position. So when you're doing your normal chest breathing, okay, there's a slight rise and fall, rise, or I should say fall and rise with the diaphragm as you breathe normally from the chest. But when you do the standing posture and you bend the knees, tuck the pelvis forward, relax the shoulders, and again you breathe in a sense from the abdomen. You breathe in from the chest but breathe out from the abdomen, relax. Okay, this helps the diaphragm to come up a wee bit more and helps to eject the waste gas from the respiratory system. So this is the first element that we start to use to help improve and help make the best of our respiratory system, is to do a wee bit of standing pose practice. Now obviously you don't do this all the time, you can't walk around like this all the time. You want to do this practice as regularly as you can for a few minutes or maybe 5-10 minutes during the day. Again, especially if you do have problems with your breathing, it's just good practice. Okay, now the next part is how we engage the rest of our ribs and the rest of our chest to increase oxygen supply in the body. Okay, so what we're going to do now is again have a sense of how the body works when we breathe normally, breathe naturally. So what we're going to do, we're going to bring the left hand across and we're going to rest the left palm on the side of the ribs, okay, below the chest and just above the hip. So we want to feel the ribs. We relax the shoulders, let the right arm hang normally. And again, we're just going to breathe normally, breathe naturally. And we're going to stand normally, stand naturally. So just breathe normally, breathe naturally. And just be aware of how the ribs are moving, if they're moving at all. So again, when you breathe normally, breathe naturally, as you normally would. So if you were standing anywhere, standing in the queue somewhere, okay, the chest rising and falling, you'll find that there's very little movement in the ribs. Okay, but now we're going to change things. Okay, we're going to do our standing pose posture. We're going to have the feet shoulder width apart. We're going to bend the knees. We're going to tuck the pelvis forward. We're going to bring the head up. Okay, we're going to relax the shoulders. Let the arms hang down by the side. Okay, now what we're going to do this time is, again, we're going to bring the left hand across. We're going to rest it on the ribs, the lower ribs, just below the chest and above the hip. But what we're going to do this time is the right shoulder is going to come back. We're going to stand normally, stand naturally. We're going to lift the elbow very slightly. We're going to breathe in, and then as we breathe out, we're going to bend the knees, tuck the pelvis forward, bring the shoulder, right shoulder forward as the hand comes forward, and we're going to imagine we're holding a big ball against the belly button with our right hand. Okay, so we're going to breathe in, stand normally, bring the shoulder back, raise the right elbow very slightly, breathe in, and then breathe out, bend the knees, tuck the pelvis forward, bring the hand forward as if you were holding a large ball in front of the abdomen. We're going to breathe in. Now it's important when we do this that the shoulder comes back and doesn't go up. Okay, so again, when we lift the elbow, sometimes the brain thinks that the elbow and the shoulder joint are just one big lump of wood. But your elbow joint and your shoulder joint are separate joints. So the shoulder stays down as the elbow comes up, but the shoulder joint goes back as you do that. And this movement, okay, helps to expand the chest, but it also helps the ribs to come out very slightly. So we'll do this together, both arms together. Okay, we normally stand naturally. We bring the shoulders back. We breathe in, lift the elbows, and then bend the knees and tuck the pelvis forward and bring the hands back in front of the abdomen. Okay, as if holding a large ball against the belly button. So we breathe in, stand normally. The shoulders come back. They don't come up. We lift the elbows, shoulders stay down, breathe in. Then we bend the knees, tuck the pelvis forward, holding the movement. Okay, breathing in and breathing out. So when we do this, what we're doing, when we bring the shoulders back, elbows come up, we're expanding the chest, we're opening the chest, we're letting more air in. But when the elbows come up like this, what happens when you had your hand on the ribs, you should feel as though the ribs come out a little bit. Okay, so when you lift the elbows, you can feel it with the left hand, you feel the ribs, lower ribs come out and up slightly. And as the shoulder comes forward and the hands come forward, the ribs come in very slightly. So as you do this breathing with the shoulder back, elbow up, and then breathe out, shoulder forward, hand forward, the lower ribs are going out and in. So you're using the ribs, not just the chest, to breathe. So you're using the whole of the chest here, the thorax, to bring in more oxygen. When you do this, this lifting of the ribs, this lifting of the chest, okay, activates muscles in the chest that connect to the ribs, and that helps to expand the lungs and let in more oxygen. And when you bend the knees, tuck the pelvis forward, the hands come forward, you activate the diaphragm, and that helps to expel the gas. So this is the yin-yang of respiration, in and out, open, close, breathing in, breathing out, working together in harmony. And this makes the best use of your respiratory system. And I would definitely suggest, if you do have a problem with breathing, whether it's asthma or COPD, is to try this method and see if it helps with your breathing. Okay then friends, on to the next exercises. Okay then friends, so the next exercises we're going to do are called Qigong exercises. Qigong, which generally translates as energy breath exercise or energy breath skill. And we're going to do 3, and they're specifically for the lungs. These are very, very old exercises. They go back at least 1700 years, and the ones we're going to be doing have been adapted by Professor Hu Xiaofei, formerly of Beijing University. Okay, so first thing we're going to do is just bring the feet together. Okay, we're going to bring the hands in front of the abdomen, again as if we were holding a ball in front of the belly button. We're going to bring the weight to the right leg. We're going to step out to your left with your left foot. It's not a big step, you just step out shoulder width. As you do so, you turn the palms down. Okay, now you're going to turn the head to your left, bring the shoulders back, lift the elbows very slightly, breathe in, turn the head forward, breathe out, bend the knees, tuck the pelvis forward, and then bring the weight back to the right foot. Okay, now we're going to go to the right. We're going to hold the ball in front of the abdomen. Okay, bring the weight to the left foot. Turn the palms down, step out with the right foot. Look to your right. Breathe in, bring the shoulders back. Raise the elbows. Turn the head forward, breathe out. Again, bring the hands back in front. And then bring the feet together. Okay, so I'll show you that again. Bring the weight to the right foot. Hold the ball. Step out, breathe in, look to the left, look forward, breathe out, bend the knees, tuck the pelvis forward, bring the hands in front and bring the weight back to the right foot. And again to the right, hold the ball, bring the weight to the left foot, step to the right, look to the right, breathe in, shoulders back, elbows up and breathe out. Okay, and then bring the feet together. And again, do as many repetitions as you feel is comfortable, but I wouldn't recommend doing more than about 9. That's a good exercise. Again, the idea is not to tire yourself out. The exercise is to harmonize the breathing with the movement. Okay, now on to number 2. Okay then friends, this next one we're going to do, number 2, is called drawing the bow, and again it's specifically for the lungs. So again we're going to step out to the left, we're going to step out to the right, but what we're going to do as well is we're going to change the shape of our hands. So when the hand that stretches out, okay, stretches out to the left or the right, we want to change the shape of the hand. So we're going to fold the middle finger, fourth finger and little finger in, and we're going to straighten the first finger and straighten the thumb. This is called the L-shaped hand. And the reason we do this is to wake up the energy lines or meridians in traditional Chinese medicine for the lungs and the large intestine. Okay, and the other hand makes the hook. So this exercise is called drawing the bow, and the idea is you imagine you're drawing the bowstring on a bow ready to shoot an arrow. Again, the breathing and feeling relaxed is just as important as the movement. Okay, so here we go. Bring the feet together, get nice and relaxed, get nice and settled. Bring the hands in front of the abdomen as if you were holding a ball. Okay, and what we're going to do, we're going to turn the palms down first of all. We're going to step out to your left. Okay, we're going to shoulders back very slightly, lift the elbows very slightly. Bring the hands up and we're going to cross them. The left arm's going to be nearest to the chest. The right arm is furthest away because we're going to stretch out now with the left hand. So the left hand makes the L shape, right hand makes the hook. The right elbow goes out, the left hand goes out. You see that the elbows are up, but the shoulders are relaxed. We open the elbows, we open the chest, we look at the left hand, we breathe in, and then we relax the wrists and the fingers, turn forward. Right hand comes up and goes out, we breathe out, we bring the left foot in, and we relax. Okay, now again we're going to the right now. So we hold the moon, hold the ball in front of the belly button. Okay, we turn the palms down, we step out to the right. Hands go out and up. We're going to bring the shoulders back very slightly. Lift the elbows very slightly. Crossing the arms. Right arm is now nearest to the chest. Now the right hand makes the L shape. The left hand makes the hook. Elbows are up. We open the shoulders, we open the chest, we look at the right hand, we breathe in. We relax the wrists and the fingers, look forward. Left hand comes up and goes out as we breathe out, and we bring the feet together. Okay, so let's have a go at this. Bringing in the breathing. So we hold the moon, get nice and settled, nice and relaxed. Breathe in, breathe out as we step. And breathe in as we open, and breathe out as we come back in. Now again with yourselves, breathe normally, breathe naturally. Don't force your breathing. When I say breathe in, breathe out, it's just as a guide. Okay, so again, holding the moon, drawing the bow. Breathe in, relax, breathe out. Crossing the arms, right arm now nearest to chest. Breathe in as we open and expand. Look at the hand as you stretch. Relax, look forward. Left hand comes up and goes out. And breathe out as you come back in. Okay, and again. Relax, breathe in, breathe out as we step. Crossing the arms, breathe in. And breathe out. Okay, now going to the right. Again, hold the ball. Breathe in, relax. Breathe out. Crossing the arms, right arm nearest to chest. Right hand makes the L shape. Breathe in, and we open and stretch. And breathe out. Bring the feet back in. Okay, see how you get on with that one. Okay then friends, so the third one we're going to do is called pushing the mountain. And again, this is a good exercise for strengthening and also helping the lung health as well. And what we're going to do is a basic exercise. There's two ways you can do this. The first exercise, we're just going to bring the arms up as far as the shoulders. Again, nice and relaxed. We're going to drop the elbows, bring the back of the hands towards the shoulder joints. Now again, we're going to make the L shape with the hands. It's going to be with both hands this time. Bring the shoulders back. We're going to breathe in. We're going to bend the knees, tuck the pelvis forward, and as we breathe out, we're going to make a sound. We're going to make, first of all, the sound. Okay, so this sound is a wee bit like you're telling somebody to be quiet. You go shh. It's that sound. Shh. And the reason we do this is it helps us to breathe out just a wee bit longer than when we breathe in. If you're able to do this, especially if you have asthma or COPD, if you can breathe out slightly longer, if you do this exercise, breathe out slightly longer when you breathe in, it helps to strengthen the respiratory system. Obviously you don't do this all of the time. It's just an exercise that you might want to do a couple of minutes every day to try and help and strengthen the respiratory system. So this is, we'll do it the first way first of all. So again, we just stand normally, stand naturally. Let the arms relax, let the shoulders relax, let the arms just softly float up, only as far as the shoulder level. We then drop the elbows. Okay, the back of the hands come back towards the shoulder joints. We make the L shape, we breathe in, we pull the shoulders back as we breathe in, opening the chest. Then we bend the knees, tuck the pelvis forward, and as we breathe out, and then we relax. Again, take a moment to relax. Take a moment to relax the shoulders. Okay, breathing normally, breathing naturally. Okay, now dropping the elbows, bring the shoulders back, make the L shape, breathe in, bend the knees, tuck the pelvis forward, and okay, again, take a moment to relax. Relax the shoulders, relax the breathing. Breathing in, bend the knees, tuck the pelvis forward, and relax. Now again, there's two ways you can do this. That's the first way you can do it. That's a very strong way to do it. That helps to strengthen the respiratory system. If you kind of struggle with that a wee bit and you want a softer way to do it, then the other way to do it, which is meant to help clean the lungs, or what the Chinese say, purge the lungs of toxins, is you make a softer sound. Like a small snake hissing, or maybe a small release of gas from a leaky radiator, or whatever you want to imagine it. But it's a soft sound. Okay, so we'll have a go at this one. This is the second way to do it. So bring the arms up as far as the shoulders. Okay, drop the elbows, breathe in, make the L shape. Now this time a softer then relax. So doing it the second way, you might feel it's a wee bit more comfortable, especially if you do have problems with the lungs. Breathe in. And again, taking the moment to relax. Breathe in. And relax. Okay. So that's the third one. That's called pushing the mountain. Have a go at that one and see how you get on. Okay then friends, so the last one we're going to do now is another standing pose posture. We're going to finish with this one. And this is for, again, the lungs. This is to help the health of the lungs. And it's called Gazing at the Waterfall. And it's from Professor Hu Xiaofei, formerly of Beijing Sports University. Now, before we do this one, it's important that you actually find what's called an acupressure point in the body that's specifically for the lungs. And this is known in Chinese as the Zhongwu point, also known as the cloud gate point. So to find this, what you do is you just bring your fingers up and you find your collarbone, find the hard edge of your collarbone, and you follow the edge of the collarbone until it gets to the shoulder joint. Okay, and when you reach the inside of the shoulder joint, come down underneath the collarbone on the top of the chest. So you need to be below the collarbone and inside the shoulder joint and pressing down on the top of the chest. And that's the Zongru point, the cloud gate. So you need to remember this point. You've got one on the other side as well. Again, you're following the hard edge of your collarbone till you get to the shoulder joint. Come on the inside of the shoulder muscle, below the collarbone, till you find the top of the chest. So you've got to be below the collarbone and find the top of the chest. And that's the Zongru point. So remember those 2 points. Okay, so the first thing we're going to do is just get our hands energized. So the way we do this is just stand normally, stand naturally. Bring the hands in front of the body as if you were holding a ball. Football, netball, basketball, rugby ball, whatever you like. Again, try not to have the elbows stuck to the body. Okay, have the elbows forward. Okay, get yourself nice and settled, nice and relaxed. And what you're going to do, you're going to imagine as you breathe in that the ball is expanding, your imaginary ball is expanding, is pushing the hands out. And then what you're going to do, you're going to draw the elbows in towards each other. You're going to bend the knees, tuck the pelvis forward, and you're going to breathe out, and you're going to imagine you're squeezing the ball as you breathe out. Stand normally, stand naturally. Breathe in. The ball expands, we open. Now imagine the elbows coming in towards each other. We breathe out and we squeeze the ball. Bending the knees, tucking the pelvis forward. Breathing in. And breathing out. This is called opening and closing the ball. It's a very good Qigong exercise for getting energy, or chee as the Chinese call it, into the hands. We're getting a feeling of energy in the hands. Breathing in and breathing out. So again, we're harmonizing the breathing with the movement. We want to be nice and relaxed, and again, especially in the shoulders. We want the shoulders nice and soft, nice and released. Okay, so you want to do that for a few minutes. Once you've finished that, stand normally, stand naturally. Bring the center of the palms together and give them a good rub. Now once you're nice and relaxed and you've got a wee bit of energy in the hands, okay, after about a minute or so, you're going to feel a tremendous amount of heat in the hands. Now again, obviously if you rub your hands together, that creates friction and it's going to get warmth in the hands. But when you do this and you're nice and relaxed and you've done the opening and closing the ball exercise, you'll feel a tremendous amount of heat in the hands. And in fact, the whole body, after about a minute or so, will start to feel hot. So when you get that hot feeling, and you get the feeling of heat in the hands, that's almost like it's burning, okay, that's good. Then you stop. Okay, and what we're going to do, bring the hands up in front. We're going to breathe in, and we're going to cross the arms. Now we're going to take the center of the palms, and we're going to rest them over the Zongru point. Okay, and you want the center of the palms to rest on that point, okay, in the top of the chest, because you want to feel the warmth from your palms going down into the top of the chest. So you want to relax the shoulders. The elbows have to sink. You don't want the elbows up, you don't want the shoulders up. Shoulders have to come down, and the elbows have to be relaxed and down so that the center of the palms can rest on the top of the chest. And again, you just stand normally, stand naturally, and you want to feel the heat from the center of your palms going down into the top of the chest. Now again, stand like this for as long as it feels comfortable, or sit like this. If you find standing too long, if you've got problems with the knee joint or the hip joints, and you just can't stand for any length of time, motionless, then what to do is just sit down. You can do this sitting down. But 10 minutes is a good practice. Okay, if you can stand for 10 minutes and feel the warmth for 10 minutes, that's good. What you're doing here is you're warming the lung channel. The lung channel, a Chinese doctor or acupuncturist, he or she, if they're going to place needles on the lung channel, will come up the arm okay, and on the inside of the shoulder and down onto that zong vu point. So when you place the hands over there and you warm that point, you bring warmth down into the lung channels. The lungs don't like the cold. This is why in the autumn the Chinese say look after the lungs and the large intestine as well, but specifically the lungs, because the lungs don't like the cold air. So you want to keep the lungs nice and warm. Another tip as well is peppermint tea with licorice root, pucker. Do peppermint tea with licorice root tea bags. If you can get them from your local supermarket, licorice root is very good for the lungs. Okay friends, so have a go at these exercises, see how you get on. I hope they help you, especially if you do have problems with the lungs. And leave any comments. If you do find that it is helping, then please leave some comments in the YouTube channel. Okay, thank you very much friends. I hope you enjoyed the video.